third presentation will be done by John, talking about the associated factors to accepting vaccination COVID-19.
Good morning. I am presenting an abstract titled Factors Associated with Willingness to Receive COVID-19 Vaccine Among Adults in Rural Western Uganda between January to April 2022. I am Dr.Turyagumanawe from Makerere University School of Public Health, FETP. I had contributions from Andrew, Winfred, and Juliet of Makerere University School of Public Health. So this is the presentation outline. We are going to have the introduction, the methods, the result, the discussion, and conclusions. So
foi alvo global e desde março 2021 Uganda tem implementado a vacinação e isso depende com a produção, especialmente nas zonas rurais, onde avaliamos a vontade da pessoa para receber a vacina no distrito rural de Uganda. Assim, fizemos
On a utilisé les méthodes
between January and April 2022, whereby we did a household survey and key informant interviews. The study population were adult residents and healthcare workers participating in the COVID vaccination program. The sample size was 379 adult residents, assuming a precision of 5%, and also assuming normal distribution and randomness. So we also had 8 key informant health workers at Hoima Regional Referral Hospital who were participating in the COVID vaccination program. The sampling technique for the quantitative arm, it was random multi-stage sampling.
onde selecionamos paróquias, aldeias e escolas e as casas e consideramos o líder ou o mais velho naquela casa. Então só foi
we did purposive. The health workers who were participating in the COVID vaccination program and the ones who had actually treated patients during the first wave, they were considered purposively, and they would identify the subsequent health workers to be interviewed by snowball method until when we achieved redundancy. So data collection for the quantitative arm, we used a structured questionnaire whereby participants self-reported on willingness to receive the vaccine by answering a yes or a no, and also on other factors such as the demographics and the other factors like distance and so on. So for the qualitative arm, we used a key informant guide. Data analysis. In the quantitative, we assessed the level of willingness. We presented it with frequencies and percentages, and the factors that are associated we did univariate analysis to obtain crude prevalence ratios and p-values. Then the factors that were significant at univariate level, they were taken to multivariate analysis to obtain adjusted p-values and prevalence ratios and confidence intervals. For the qualitative arm, we used a thematic approach whereby we got statements, themes to get the subjective meanings. These are our results. All the 379 participants had heard about COVID-19 vaccination, and the commonest source of information were hearing it on the radio, adverts and announcements and programs, hearing it from the friends in their social circles, and some of them from the health workers. They got counseling, those percentages reflected. And overall, the level of willingness was at 71%. So this table shows the factors that are associated with willingness to receive COVID-19 vaccine. So we can see that willingness was significantly higher among people who had tertiary level of education with adjusted prevalence ratio of 1.2 and 95% confidence interval of 1.1 to 1.4 and a p-value of 0.03. More so, people who resided within less than 5 kilometers from the health facility, because the health facilities were the vaccination posts at the time. They were 1.2 times more likely, they're more willing to receive the vaccine with a 95% confidence interval of 1.1 to 1.3 and a p-value of 0.04. So the participants who had heard about the vaccination from the health workers were significantly more willing at adjusted prevalence ratio of 1.3, 95% confidence interval of 1.2 to 1.6. And finally, those participants that perceived health workers to be friendly, they were more willing at adjusted prevalence ratio of 1.2, 95% confidence interval 1.0 to 1.4, and a p-value of 0.04. From the qualitative arm of the study, perceived fear of loss of libido and infertility was a major concern across interviews, and that bad willingness. As we can see from the quote of one of the key informants, when COVID-19 vaccination came, people were saying that actually if they vaccinate you, in the long run, you may fail to produce, or it may ban sperms in men. They are worried that they will not function in bed after the vaccination. So conclusion, willingness to receive the COVID-19 vaccination was high in rural setting, but safety concerns were a main barrier. And therefore, strategies to improve COVID-19 vaccination programs in rural settings may focus on bringing the vaccine closer to the people via campaign mode or outreaches and health education messages through local radio stations to counter fears on reproduction and misconception about the vaccine. So these are some of the measures that were actually implemented to have us get better success. I acknowledge the people who participated in this study listed here, and I thank you for listening to me.